Hi, I'm Ernesto Cullari, Republican candidate for Congress in New Jersey's 6th District primary, being held Tuesday, June 5th. Real problem, Obamacare. While much of the law doesn't kick in until after the next election, the framework for Obamacare has already been laid. It's a law that's riddled with 2,700 pages of taxes and regulations thrown on the backs of American taxpayers and American job providers at a time when resources and jobs are few and far between. Over the next 10 years, independent sources say that over $2 trillion of debt will be thrown on the back of the American taxpayer. What's most troubling about Obamacare, however, is that it takes the power of choice away from doctors and patients and puts it in the hands of far-off bureaucrats living in DC with the Department of Health and Human Services. Medicine is a passion of mine. While I'm not a doctor, over the last 10 years I've done what's called dynamic splinting. I work alongside orthopedic surgeons, occupational therapists, and physical therapists. I work hands-on with their patients, teaching their patients how to use a device that helps them get better quicker. And I've seen many changes in the healthcare industry, but what's most troubling is what I've seen recently in healthcare due to Obamacare. I recently met with a group of doctors, general practitioners, that told me that hospital administrators had approached them and audited their patient list. Inpatients of theirs were identified to have suffered from cancer, stroke, liver or kidney disease, and neurological disorders. These are patients that are staying in hospitals that need round-the-clock care. Hospital administrators identified these patients as patients that should be sent home to receive spiritual counseling, psychological counseling, nutritional counseling, and pain management. At a time when patients need care most, hospital administrators are rationing healthcare. So why would they do that? These are all patients that receive Medicare. Didn't they pay into the Medicare lockbox? Well, it turns out that these Medicare patients, like all Medicare patients, are capitated. And what that means is that the government is only willing to spend a certain amount of money on each patient. So therefore, the hospital gets one lump sum check to treat all these patients. And the less money they spend on these patients, the more money that ends up in their pockets. Now, you might say, well, the hospital's the villain, Medicare's the villain. Well, the truth is that Congress has been the villain. Medicare was to be a Medicare lockbox. But our Congressman, Frank Pallone, chose to take $500 billion out of that lockbox and apply it to Obamacare. So it's no wonder that at a time when patients need health care most, they're not receiving the care they need. Real solution. Patients need to be able to purchase health insurance across state lines. Currently, if a company in Maryland is providing quality health care at a more affordable price than a health insurance company, say in Nevada, those two companies currently can't compete for your business. If we want the most quality care for our patients, patients should be able to make more choices about where they purchase their health insurance. Pre-existing conditions could also be covered because there would then be a marketplace for insurance companies to provide that kind of care. Real solution. The FDA needs to be reformed. The Cato Institute recently published a paper that cites there's an undue political influence upon the FDA that goes into deciding which drugs and which treatments patients receive. Case in point. A recent New York Times article cites that our own Congressman Frank Pallone influenced the FDA to approve a device to be implanted in the knee by a company named Regen Biologic. Their implant had been denied a few times before by the FDA, but after Frank Pallone received a campaign contribution of $8,900 from executives from that company, their implant from Regen Biologic was quickly approved. Vote for me Tuesday, June 5th. I'll work to reform the FDA. I'll make sure that crony capitalism does not affect the medical industry, and I'll work tirelessly to both repeal and defund Obamacare. Vote for me Tuesday, June 5th.